Supervisors, it is now 7 o'clock. I call to order this regular
All of a
meeting.
sudden, I can't hear.
Calling to order the Eau Claire County Board of Supervisors at 7 o'clock on this Tuesday, January the 19th, 2021. We will first have the honoring of the flag, followed by a moment of reflection by Supervisor Beard. So supervisors, please unmute. And
Okay. I pledge allegiance to the flag of
the United
States
of America,
and to the republic for which
it stands
one nation,
under God,
God, indivisible,
liberty,
with liberty
and justice
for all.
thanks,
I'd like.
thanks for doing that together. Supervisor,
Yeah, right.
Supervisor
For
Beard,
Martin Luther King Jr. Quote. I'm sorry. Okay. Nick is cutting in and out, so sorry. Tonight,
sorry.
I'd like to offer a quote from Martin Luther King Jr. Faith is taking the first step even when you can't see the whole staircase. And I thought tonight, as we start our new year, we can take our first step, and we have a lot of important issues that will be coming before us, but I think we have a really good board, and I do have faith that we'll be able to come to some very good conclusions. So thank you.
Okay, thank you. My fellow supervisors, we pause this evening in honor of and in memory of our colleague Bruce Willett, who died 2 weeks ago. Bruce was a friend, a mentor, a model, a moral beacon, yes, sometimes a gadfly, but always a preeminent public servant who kept himself and us focused on the common good and common sense. Bruce served on this board for 25 years, from 1994 to 2018. 4 of those years as county board chairperson, from 2004 to 2008. Bruce was our moral conscience, always reminding us, sometimes very persistently, but always gently, of our duty to serve and care for our fellow citizens, our fellow human beings. Each of us is a better person for having known Bruce. Each of us has personal stories of our encounters with Bruce. We do not recount them tonight, but we hold them in our hearts as we remember our colleague with this silent moment of reflection and remembrance. Thank you, supervisors. The next item on our agenda is call of the roll. Sue McDonald, for her first time, will call the roll.
Gibson.
Present.
McKinney.
Present.
Knight.
Here.
Pagonis.
Here.
Anton.
Here.
Zook.
Here.
Chilson.
Here.
Stelgis.
Here.
Mowry.
Present.
Coffee.
Here.
Henning.
Here.
Bates. Colleen, I know you're there. Russell.
Present.
Gatlin.
Present.
Smyer. Jared. Hambuck Boyle.
Here.
Neiman.
Here.
Dunning.
Here.
Wilkie.
Here.
Anderson.
Present.
Mark Beckfield stated he would not be on tonight.
That's correct.
Okay. Schneider.
Here.
Leary.
Here.
DeLuca.
Here.
Jansen.
Here.
Schroffnagel.
Here.
Roberts.
Here.
Kronk.
Here.
And Christofferson.
Here.
We have 28 present.
We have quorum. Thank you very much. Next item on our agenda is approval of the Journal of Proceedings from December the 15th, 2020. The chair will look for a motion and a second, and then we have a comment. So a motion first by voice.
One motion to approve as presented.
Welke moves to second.
Okay, it's been moved and seconded. Are there additions, corrections, or comments?
I have a comment.
Thank you. Go ahead.
I have a concern regarding approval of the Journal of Proceedings dated December 15th. Before we approve the proceedings, I'm asking that the proceedings be updated to include important additional information related to DHS and the report made by Attorney White. We need a fuller picture of the work done by Sheriff Kramer and Attorney White so that we might better carry out our legally required oversight responsibilities. In addition to providing a forensic audit, the journal should also include 1, reference to documentation that shows Attorney White's legal authorization to serve as counsel. 2, documentation of the process used by Sheriff Kramer and Attorney White to the DHS audits. Specifically, what records were requested and was that request made as an oral one or written, and what response to the request was made and was it oral or written. And finally, 3, documentation of how satisfied state statutes 19.31 and the Wisconsin Public Records Law Compliance Guide for 2019. Adherence to these documents raises a question. Records requests made by Sheriff Kramer have been legally denied based on the volume of records requested. The state statute and the compliance guide strongly encourage mutual discussion between the requester and the records custodian when there is a disagreement. Use of subpoenas and search records is recommended only as a last resort. Again, because we have oversight responsibility, before we approve the December 15th minutes, to be given more information for our review. I am asking for a no vote approval of the minutes. Thank you.
I'd like to point out to you that the Journal of Proceedings is a report of what was presented or what occurred. It appears to the chair that what you're mentioning now would really be a request for an item to be moved on to an agenda. All we're doing in the Journal of Proceedings is approving what happened, what was reported.
Okay, so you're saying that could be brought up next meeting?
Yes.
An item?
Yes, and I will consult with you about how to do that, how to bring that onto the agenda.
Okay, I would appreciate that very much.
Okay, let's.
Thank you.
Okay, is there any other comment, any other corrections to the Journal of Proceedings? Okay, all those in favor of approval of the Journal of Proceedings as presented, please indicate by saying aye.
Aye.
All those opposed by nay. It is unanimous. Thank you. The next item on our agenda is the oral reports. I'm going to begin with a welcome to our new County Clerk, Sue McDonald. Sue has worked in the Eau Claire County Clerk's office as Chief Deputy for almost 9 years. Her past work experience includes being a Wisconsin County Account Manager and GIS Technician for Applied Data Consultants here in Eau Claire, as well as a GIS Land Information Technician for Clark, Trempealeau, and Jackson counties. Sue grew up in Wisconsin, in Eau Claire, and attended the University of Wisconsin-River Falls. After college, she and her family resided in the Neillsville, Humburg, and Osseo areas for 12 years and moved to Eau Claire in 2006. Currently, Sue, her husband, and their 17-year-old son live in Eau Claire. Sue is an avid mountain biker and cross-country skier and enjoys anything that has to do with being outdoors. She and her husband have been coaches with the Eau Claire youth cycling team for the past 3 years. Supervisors, we welcome Sue McDonald, and we can do that with claps or waves. Welcome, Sue.
Thank you.
Chair Schmeier,
Yes.
it's Martha Neiman. Is there no
Yes.
public comment tonight? Did I miss something?
Oh, I apologize. I skipped over it. Thank you for being my conscience, Supervisor. Thank you. Let's return to that. Apologies to the board. Public comment. I need Samantha's help here. Samantha, help me.
Clerk McDonald is all set up. I believe we have 4 who have indicated verbal comments, and the rest have been sent to the board.
Geez, again. Clerk McDonald, are you prepared?
I am. I just wanted, would you like me to read the who are for and against before I recognize the speakers, or just go ahead with the speakers?
Well, I think what we've done in the past is have the clerk read off the names of those who support the ordinance, then the list of the names of those who oppose it, and then we'll do the verbal presentations.
Okay. All right. So on our list, we
Pages.
have, as far as people who are for, Kath Walker, Steve Anderson, Maury Pasternak, Holly Hart, Margot Bouchard, Lois Helen, Mary Hayden, Terry Stanley, Cassie Draper, and Shannon Markwell. And for those who are opposed, I have Melissa Krogman, Joshua Andrew, Douglas Lightfoot, Miriam Jacobitz, Kayla Rick, Dory Pulse, Marina Schick, Susan and Terry Miller, Mark K, just an initial for last name, Kyle Braun, Steve and Leslie Stray, Jeffrey Makushik, Diane Peterson, Corrine Weiss, and Christina Swenson. And then there are 3 that we're unsure of their position on this: Maggie Venepal, Jason Gonzalez, and Katie Forsyth.
Thank you. Before we begin the verbal comments, just a reminder, the comments are limited to 3 minutes. We have a total of 30 minutes for public comment. So you call the first person to comment.
Okay. Kayla Rick, are you on the line?
Yes, can you hear me?
Yes, we can. Go ahead.
All right, thank you. First of all, thank you for taking comment on the mask ordinance. I am strongly opposed to an ordinance requiring any medical intervention or devices. If a sick person sees a doctor or a provider, they have a right to decline any intervention or treatment plan. When the government takes away the right to decline medical interventions outside of a hospital and when healthy, it is a violation of patient rights and unauthorized practice of medicine. I am asking you to keep medical interventions and practices a personal decision between a patient and their provider, and respect the decisions of your constituents, who in large are already abiding by health department guidelines without the threat of a fine. Perhaps while discussing this ordinance, you can clarify what percentage of the total population in Eau Claire this ordinance is targeting. I believe this ordinance will result in continued division of our community and in people seeking out neighboring counties to shop in, where medical interventions have not been written into local law. For our small businesses, this will be another barrier here in Eau Claire. I'm asking that you vote no. Thank you.
Thank you. Clerk McDonald.
Next up, we have Maggie Venepal. Are you on the line?
Yes, I am. And I just would like to make a note that I am strongly opposing this ordinance because I think that you had me down as undecided.
Okay.
But just to clear that up. So, okay. Good evening, County Board Supervisors, and thank you for the opportunity to address concern regarding the proposed mask ordinance. I would like to start by expressing my extreme disappointment that public comment needs to be done over the phone. Chippewa, St. Croix, and Trempealeau all let the county residents participate face-to-face. My question to each of you is, if masks work so well, why can't we enter the building, stay distant, and speak to you live? Keeping us out of these meetings is contraindicated to what you are trying to mandate. It is human instinct to judge someone who thinks differently, but before jumping to conclusions about who we are and what we are saying, please just listen, really hear us. We are your friends, your neighbors, your coworkers, your supporters, your customers, and your fellow Eau Claire County residents. The name of our nation claims that we are united, but throughout the past COVID-19 year, one would disagree. The current level of social friction has continued to escalate, and sooner or later, we all must make an effort to reunite. This ordinance would not help us unite. It will further the divide in Eau Claire County. Enforcing a mask mandate and a fine associated with it would ensure citizens turn on other citizens. It would create confrontation, discrimination, rebellion, and potentially violence between the citizens you took an oath to serve. Sadly, I have had many conversations with residents claiming they would move out of the county if the ordinance was passed. Additionally, people are already preparing to take their shopping elsewhere outside the county lines. Continued individual responsibility is the best plan to move forward for Eau Claire County. Health ordinances have been attempted in the surrounding counties of Dunn, Chippewa, St. Croix, and Trempealeau. All counties have voted no. Furthermore, I was not able to find one ordinance in the state of Wisconsin with a fine associated to it. Enough is enough, Eau Claire County. You have taken an oath to uphold and defend the Constitution of the United States of America and the state of Wisconsin. This ordinance is in clear violation of those rights. We, the people, have notified you of this with the cease and desist order that was sent to each of you via email. If you choose to proceed with this ordinance and you vote to pass it, we currently have 693 people ready to file a formal complaint against you for violating their rights. The unlawful and unconstitutional acts committed by you in your appointed capacity under the color of law holds you both professionally and personally liable for your actions. If you do
30
not
seconds.
cease and desist, if you do not immediately cease and desist, we the people are prepared and have the assistance of counsel to seek remedy against this body and each individual. Please stop this now. Stop making our medical decisions for us and allow the community to come back together. Thank you for your time.
Thank you.
Next up is Jason Gonzalez. Are you on the line?
I'm here. Can you hear me?
Yes.
Can.
Okay. Thank you for allowing time for comment. The past year has been hard on everyone, especially with the loss of life, but also with people having sacrificed a lot, being asked to change their lives, and largely people have complied with the COVID interventions. It was first 2 weeks to stop the spread. Now the requirements look never-ending. There's plenty that people can do to protect themselves without making anyone else do anything. Enforced restrictions preventing people from being able to breathe normally and share human expressions carried out over very extended periods of time is crossing the line. What about the damage to children's social development? With social distancing and masks in school, we are teaching a whole generation to be antisocial, to fear one another, and not to trust their own bodies. Teachers can utilize N95s if they choose, or maybe some teachers can be virtual only. The head of the CDC stated back in August that masks protect the person wearing the mask better than a vaccine. So if masks protect the wearer, let people choose whether they want to wear a mask or not. COVID-19 is a respiratory virus, which we knew last year, yet we were told that there's no reason to go around with a mask. But now there's the push to mandate it. Anyone can access data and see where mask mandates have been imposed, yet cases and deaths continued to rise. 13 states have not implemented mask mandates, and 5 of them have lower mortality rates per 100,000 people than Wisconsin, where we've been under a mask mandate for 6 months. In Eau Claire, our cases went up about 5 times as much about 6 weeks after the mandate was implemented. Please keep medical practices as recommendations. Thank you for your time.
Thank you.
Katie Forsyth? Are you on the line?
Hello. Yeah, I'm here. I'm going to speak to a couple of things that are very different. The first thing I want to say, and this isn't what my comment was going to be, but I just wanted to mention briefly, in the 2 terms I served on the board, I just want to echo what a wonderful leader and role model and just wonderful man Bruce Willett was. And I just wanted to add that, and I know all of the board appreciates that as well. What I'd like to talk to you about tonight is the property on the south side of the Eau Claire River that you will be considering whether or not to designate the parking area of that property as a wayside. I want to lend my support for designating that as a wayside. This property, if you're not familiar with it, is a beautiful wooded area that I think is a wonderful county resource. I've often enjoyed walking there in those woods, taking my grandchildren there for nature hikes where we looked at the variety of trees and plant species, looked at the rock formations, evidence of all the animals that live there, their tracks, buck rub, woodpecker work, and so much more. But as much as I enjoy the opportunity to walk and traverse that property, I'm very much alarmed by the uncontrolled shooting that takes place in the parking area. I've heard the shots. I've seen lots and lots of litter that I guess you could describe as shooting litter. And it is an area that you must traverse in order to be able to access the property. So I think the danger is very real and very alarming. I believe that the current situation poses a danger that threatens both the recreational uses of the property and thus devalues that wonderful county piece of property. So I hope as you consider that, you will designate the parking area for that property as a wayside. Thank you for your time.
Thank you.
Thank you. That is all the speakers that we have on the list for tonight.
Thank you. Is there anyone else online who wishes to speak?
I would wish to speak.
Would you identify yourself, please?
Yes, my name is April DuVal.
And provide your address, please.
Yes.
My address, 5316C Prill Road.
Eau Claire?
Yes.
Thank you. Go ahead.
Thank you. I was able to speak to the committee last week, but my statement is very important and I want to make sure that it is heard and that you are listening to it. So I'm asking to speak again tonight and I appreciate this time. So I am a nutrition educator and a certified health coach. I have helped hundreds of people restore their health by focusing on something that these mandates are ignoring. The main concern during our pandemic, and really all of the time, is to keep people healthy and to stop the spread of any virus. The approach by the health department and government officials has been social distancing and masking, but we're forgetting the most important part of being and staying healthy. We stay healthy by having a strong immune system. So how do we build that strong immune system? By letting it do its job, and it's meant to do this job. It's meant to defend us against germs and microorganisms. Yes, that immune system is here to protect us against disease. So we need to do things to boost our immune system. We need to focus on the foods that we're eating, more vegetables, more water, less sugar, less processed food. So where are those mandates? Where is the strong-armed guidance telling people to eat a rainbow of colors every day? Where are the signs on storefront doors guiding people to health by suggesting they up their vegetable intake today? I teach nutrition education classes, and ironically, the vegetable lesson was just on my list. We talk about how vegetables are important to our bodies, how they help heal, how they help our body fight germs. These things are also backed by science. So where is the science being listened to in this situation? Why is it just masks and social distancing, the definition of health and wellness. We need to boost our immune system. How do we do that? Activity, movement. Again, where are those suggestions? Where are the commercials and ads and signs asking if you've had 60 minutes of activity today? Where is the push to help out your neighbor? Be a good community member by boosting your immune system today. Eat your vegetables, get active. Why the focus just on masks and distancing? Let us be responsible adults and make our own decisions about what is best for our health and the health of those that are around us. We don't need government officials telling us what is best for our bodies. If you are
30
going to
seconds.
use your elected position to suggest what to do to be healthy, please give the full picture of wellness: good food, activity, water, being around people. You are elected officials. Please listen to the voice of the people who voted you into your position. Let me be clear. I do not support a mask mandate. I do not support further requesting people mask up. Please let our immune system do the fight for us. Let it do its battle, and let people choose what is best for their own bodies. Thank you.
Thank you.
Thank you.
Is there anyone else who wishes to speak? Anyone else? For the third time, anyone else who wishes to speak? Thank you. We will now move on back to the oral reports. Next is an update on COVID-19 and vaccinations from Lisa Giese, the Health Department Director.
Thank you, Chair Smyer, and thank you to the members of the County Board. We haven't come to you with a general update beyond some of the written updates that you've received, so I'm happy to share a couple of highlights with you. I would say that many things going on related to COVID-19, and the best resource that you have is really to go to our COVID-19 Eau Claire website. That website does have a lot of information that is Eau Claire specific, but also links to state and national resources. It is the location where we share updated data on a daily basis, as well as any updated policy change and information about vaccination. So a reminder to you about that. I also would remind you that weekly we do a situation summary, again, a short summary that provides some kind of in your hand information about some of the top issues. It does have now a front page to it, an executive summary that really is intended to support individuals like county board members and city council members and others, and having a one-pager that gives you a basic scan of what's happening with COVID-19 in Eau Claire. If you have not signed up to get those situation reports automatically, you can do that. Again, if you go to the COVID-19 Eau Claire website, it has a link there that you can make sure that you get those automatically every week. They typically come out on Thursdays. A couple of quick updates, and then certainly if Chair Smyer sees time available, I can certainly answer questions as well. We are now at over 10,000 individuals in Eau Claire County that have tested positive for COVID-19, 10,133. 92 individuals that are Eau Claire County residents have died, so 92 deaths of family, friends, and neighbors. And 322 Eau Claire County residents have ever been hospitalized. That's the basic data that we share on the impact of disease in our community. Again, there is a lot more data available on the website. We do have a map that shows cases per jurisdictions within the county. So for some of you, you may want to look at a more discrete area of the county and look at case numbers in those areas, but we do have disease spread across the entire county. The good news is that in the last number of weeks, our case numbers have flattened and this week appear to be going down. So that is very positive news. We still are well above the case numbers per day that we are, the state and national resources really want us to be below for our population. That's about 10 cases a day. We still have a ways to go, but certainly really positive news that we are seeing movement in the right direction. We did also, though, have the first case in Wisconsin of the variant strain of COVID-19. That was news last week. You may have seen it in the media resources. So the first case was identified in Wisconsin as an Eau Claire County resident. That variant strain of COVID-19 is concerning to people across the world, but certainly here in Wisconsin, because it is a more contagious strain. So we are watching that carefully, but do know that that is one of the things that will make a difference in disease spread in our state in the weeks and months to come. Probably the biggest topic of the day is vaccination. I do want all county board members to know that there is incredible work happening in this community related to vaccination. We do have more than 6,000 individuals that have been vaccinated. So 6,543 vaccinations have been given to date. That's today's number in our community. And those are to those eligible individuals. And right now, the federal government and the state is tiering who is eligible for a vaccine. So right now, those are healthcare workers, broadly defined. And now, starting Monday, law enforcement and fire have been added to the list. We did today, the state announced that those individuals 65 and older, as of next week, Monday, would be added to the eligible groups. In Eau Claire County and in every county in the state, only agencies that have been approved by the state to give COVID vaccine can give vaccine. We are working with all of those providers in Eau Claire County, and one of the really big advantages we have in Eau Claire is that we have a very strong provider group, and we are all working together. Right now, actually, we have meetings regularly with that group to coordinate. We are making sure that all of those vaccine providers are working together to get the 1A population vaccinated. We interestingly got a request from a national news media outlet today asking to talk about our vaccination rates, because it does appear that we have been, with that coordination, really getting a percent of our population vaccinated a bit more quickly than other parts of the state and country, which is good. We also know that we, though, have a large percentage of that 1A group that lives in Eau Claire County. So we know we have a big number to vaccinate, and we are well on our way to getting those vaccines done. We also are working with those other providers to coordinate for the next step. So starting sometime later tomorrow or Thursday morning, we've worked together to have a one-stop shop on our COVID-19 website that Samantha put in the chat box. That website, if you've not been there, does have a tab for vaccination. It is already there, and there is a lot of good information there already if you haven't looked. We will be adding to that location really a one-stop shop where anybody that needs a vaccine and is eligible for a vaccine can go and find the resources they need to sign up at a provider. That will be coming out tomorrow afternoon. We're getting final clearance from all of our healthcare providers, which are part of the group that vaccinates. The health department also is vaccinating. So we have our healthcare providers vaccinating, and the health department is doing mass vaccination clinics, something we've been planning for many years and we are doing now. We started a number of weeks ago. It is an invite only for those 1A providers. We put those through in a walk-in clinic setting with appointments, and we continue to do that. As new groups are identified, we will be making our sign up more public as well. So all individuals that meet the eligibility requirements will also be able to sign up through the health department clinic site. So vaccination is a shared role at the health department of both being in this assurance role, making sure we understand all the vaccine that needs to be given and how it's being given in this community, and doing vaccination ourselves. So a very large lift. We have about, as you all know, 105,000 residents. Of those, we estimate that 85,000 individuals are over the age of 16 that need vaccination. And Of the 65 and older population, that's about 17,000 people. So we have a lot of people that need to be vaccinated in this first group. We also know that the state of Wisconsin and at a national level, there's not sufficient vaccine. So one of my asks of all of you is to help us not only understand the work that's happening, but also to help us manage the conversation in the community. Every vaccine dose that comes into Eau Claire County is getting into an arm. We're just not getting enough supply. The demand is increasing now that we have more groups that are eligible to receive vaccine. So it's only going to get ratcheted up significantly more now. And we will get as we are asking for vaccine, and whatever vaccine we get, all of the providers in Eau Claire County, those are being administered. The last thing I just want to share is that, again, there are many other things happening with COVID response. We are working with partners across the spectrum to do education, to support best practices and success in businesses and schools, really across the frame in our community. One of the things that we do is follow state orders, though, and this governor did late this afternoon announce emergency order and an executive order that does extend the face covering order for the state until March. So that did happen late this afternoon. Again, part of our job is to educate and work on policy decisions like that at a state level as well. So I think with that, that's a lot of updates in a short amount of time. Again, COVID topics, we could talk probably for an hour about all the things that are going on, but I will end my comments and turn it back over to Chair Smyer.
Are there any questions for Director Giese?
Schneider with a question.
Supervisor Schneider.
Does the governor's order make it so that we don't need to pass the mask mandate?
I'm going to field that one if you don't mind. The governor did reissue his order within a very short period of time after he did that. Senator Steve Nass announced that he and the legislature would overturn it. So the answer to your question is our proposed ordinance is a just in case, and the case may take place in the near future. So it's our ordinance is phrased as just in case. There's no way of predicting what will happen, but we are trying to assure the county that we are following best practice by having an ordinance to back up the governors if necessary. Was that Director Giese, was that correct?
That is accurate. The intent of the ordinance is to be in place if there is no governor's order, and is only in place if it's passed in that situation.
Right. Thank you. Supervisor Schneider. Sorry, Supervisor Schneider.
Yes, sir.
Answer your question?
Yes.
Okay. Supervisor Wilkie.
Yes, Director Liskey. At Judiciary and Law Committee, we had, well, obviously every meeting we have a discussion about where we sit with COVID in our jail. Obviously concerned about the inmates who are incarcerated and they can't really get away from it. And of course, our correctional officers who are in close proximity. The discussion centered around, and I think it's fair to say, committee members didn't get a clear indication. Where do our correctional officers and inmates fit in the priority? If 1A, B, C, where are they going to fill in there? Because they're obviously essential workers and in confined area. Where do they fall in place?
Thank you for that question, Supervisor Wilkie. The state actually today identified correctional officers as being eligible for vaccine in the this first tier of 1B. So similar to the law enforcement officers and the firefighters that were identified last week and started on Monday. Correctional officers today were identified in that tier as well. We did find that out this afternoon, and we are working now and have worked already with the county on identifying all correctional officers, both county employed and those others that may be connected to the corrections system that may not be county employees. So we're in process this afternoon of working on that.
Well, good. Timely for you to announce that there'll be 1B for our correctional officers. What about where inmates who are confined and obviously much more difficult to social distance than you or I? Where are they falling in the phases?
So the phase 1B group is still as a whole under discussion at the state level. The public comment period ended yesterday for that proposed 1B group. Those people that are currently in incarcerated situations, so those individuals in our jail, as well as the prison system, are proposed to be considered as part of the 1B group in congregate settings as a general category. It does include other congregate settings as well. It is out for public comment, as I said, has been out for public comment. That public comment ended yesterday, and tomorrow will be the discussion by the SDMAC group, the group that makes those decisions. We anticipate hearing in the next week or so how that group will be more specifically framed.
One final ask of you, Director Ski. I think it's safe for me to say, even though we couldn't take formal action on it in Judiciary and Law Enforcement Committee, I think the overwhelming consensus of that governing committee was, in fact, if it had been timing was critical, so we couldn't get a resolution before this board for what we were advocating for. And what we were advocating for is obviously, let's not forget that sometimes forgotten population up there at high risk. Let me pass on to you what I believe the consensus of the committee was overwhelmingly that we'd like to see them on a high priority. And any other members of Judiciary and Law, if I had an incorrect read on the position, please speak up. Otherwise, that's Judiciary and Law's feeling.
Thank you for that feedback. And the health department has certainly prioritized populations that have higher risk of adverse outcomes, and certainly populations like those that are currently in the Eau Claire County Jail certainly fall in that group.
Thank you.
Are there any other questions for Director Giese?
I have a question, please. This is Nancy Coffey.
Supervisor Coffey, go ahead.
Lisa, I want to thank you first for all of the great work that I think you and your department have done. This has been a long haul, and I really appreciated what you were talking about with vaccinations, and it brought a question to my mind, that being, if you can go to the Eau Claire County website and sign up, especially for people who are not computer savvy, like my mom who's 91 in Dunn County, will healthcare providers be reaching out to these people as well, or can we fill out signing up for other people other than ourselves? How will that work?
Yeah, thank you for that question, Supervisor Coffey. Each of the healthcare entities will have slightly different processes, but we have asked all of them to have a phone option, specifically because of the reason that you described. Some individuals don't have access to technology. Some individuals are very uncomfortable with technology. So All of the options we understand will have multiple pathways to get an appointment, and certainly would include those people that are supports to individuals that need that kind of support. So there is work happening in all of the vaccine provider groups to figure out multiple ways to make sure that people can get an appointment that need an appointment, including the health department. Our site is a sign-up site, or a site where you register for an appointment, but if people have difficulty with that, our site is also supported by a phone call if needed.
Great. And can people, like, for example, my mom who is in Dunn County, could I bring her to Eau Claire County, or would she have to get her immunization or vaccination in her county in which she resides?
It's also a wonderful question, and probably the million-dollar question in the state right now, especially for border counties to other states. The request is that people ask for and receive vaccination within the county that they reside in or they work in. Certainly, in some situations, employment is a way that people get into being eligible for a vaccine. That is the request. Certainly, nobody will be turning people away, but we really are trying to manage volume and do planning. And the easiest way to do planning is based on our population as a whole, like I earlier described. So,
sure.
Yeah.
We can make it work. Thanks.
Thank you. Are there any other questions for Director Giese?
Supervisor McKinney.
Go ahead, Supervisor McKinney.
As a member of the Judiciary and Law Committee, I would like to just support Supervisor Wilkie's comments, but also remind people that both staff and those incarcerated still have a right to refuse testing and vaccinations. Just wanted to make that comment. Thank you.
Schneider with a second question.
Supervisor Schneider.
Is there any provision for people that are homebound?
Thank you for that question. It is a conversation that we are having with all the vaccination providers. As of last week, the challenge with this vaccine is that it's very, very difficult to take out of a very controlled setting. Right now, we don't have the ability to do that type of traveling vaccination opportunity, but we certainly are aware that there are individuals that have challenges with traveling places. So that is under discussion right now with the volume of vaccine we're getting, and with this being a new vaccine that everybody's managing their clinic operations in a new way for. We don't currently have that available. Health Department is working on two options right now. One is we know that some people, for example, can't easily get to Eau Claire, so we are working on an Augusta location for vaccination. We hope to have that available soon. Doesn't meet the homebound issue, but certainly is addressing those that may not be able to travel long distances. And then secondarily, we're working through another option where hopefully we can go to some other set locations where populations that are higher risk are at. So we don't have to have everybody go to a healthcare setting or to the large health department clinic that is off-site, but where we can potentially bring vaccine in to certain high-risk situations. I know that doesn't totally answer your direct question, Supervisor Schneider, but we are working through options to try and get as much vaccine out in as many ways as we can.
Thank you. I see that I have two hands up. I have not been monitoring the hands. We've been using voice. But Supervisor Christopherson next, followed by Supervisor Kronk.
Thank you. Thank you, Director Liskey, for your report. I have a couple brief questions, hopefully. Will the list of healthcare providers that are able to vaccinate going to be made public?
So what we will be doing on our website as of again this week is those that are willing to be made public will be on our website with a link to access them. We do know that some approved vaccinators have not yet requested vaccine. They're very small providers and they got in the loop just to start with. Those won't all be there, but anybody that's currently receiving vaccine and is able to provide vaccination beyond their four walls will be on the site, yes.
And if we have uninsured individuals, will they be directed to just the Department of Health then to get vaccinated?
So all of the providers have indicated that they will take non-connected individuals, so people that aren't necessarily a patient of theirs. It's our understanding now that most, if not all of the healthcare providers will do that, but certainly anybody that doesn't have insurance also is eligible and able to come to the health department site. There isn't a charge for the vaccine um, being given. There may be a charge to an insurance company for someone that comes in that is insured, but at this point, we understand that there shouldn't be a cost to those that are either not insured or otherwise insured with a large deductible.
Okay. And will you said all the vaccines are making it in arms, and I know that's a real big concern is vaccines going to waste. Will you, as a part of your group, be tracking and reporting any vaccines that have had to go to waste?
It's a very good question again, Supervisor Christopherson. Right now, the health department does not receive direct information about the volume of vaccine doses that enter into Eau Claire County. We only get information on the volume that have been given. We're working on trying to get that as part of our assurance role. The state monitors very carefully, as does the federal government, any wasted vaccines. So for example, if a vial is open and all the doses can't be given in the time before it's no longer usable, that has to be very carefully tracked by anybody that's administering vaccine. That's one of the reasons there are fewer approved providers. So waste is documented very carefully at the state level. In most circumstances, and I know in Eau Claire, we help coordinate when a healthcare provider calls us and says, we have 9 more doses. Do you have anybody to send us? That's part of our role as well. We get them over that day so people can get vaccinated.
Wonderful, thank you. And if I could, I have one more, hopefully brief question. The testing sites that are available in the Eau Claire area, I know the UW system has been doing asymptomatic testing. And I know that's still up and running. I think that's a very important tool for our community, not only for detecting these asymptomatic cases, but also getting a true percentage and bringing down our positivity rate. Do you have any comment about keeping that type of testing going for our community?
As you mentioned, our only surveillance testing that has been happening is at this antigen testing site that UW Eau Claire has partnered with the system to do. It actually, the last day is tomorrow, unfortunately, at Memorial High School. It will be ending. The UW system is no longer supporting that strategy. And it will be a change in what we will be able to learn at a community level. We do know that we have a lot of testing capacity in Eau Claire, and individuals that are asymptomatic can go to any of the other PCR testing sites, those testing sites at healthcare, at the National Guard site that we have in 2 locations in the county. All those sites are on our COVID-19 website that is also linked there for you. If you go to the testing page, they are all listed there and it's easy access to them. So we do have a lot of capacity. The encouragement is anybody that feels they need a test for any reason, even without symptoms, should go get tested.
Thank you. Supervisor Cronk, followed by Supervisor Maury.
Thank you. And I also wanted to echo and say thank you to Liska and the department and everybody that has done an incredible amount of work. Some of my questions have been answered, so I don't want to duplicate anything, but I did have a question on the enforcement side. And I'm curious, as of right now, just to clarify, if somebody was not following the mask mandate as it stands, from the governor's order, it could be enforced at a $500 fine. Correct? Is that correct or no?
Could we hold that discussion for the point when we're looking at the mask mandate?
We can. That's fine. We can. I
Yeah.
was just, yeah, that's no problem.
We'll take note of your question and bring it back
Thank
at
you.
that point. Thank you.
Okay.
Is that it?
For me, yes.
Okay, thank you. Supervisor Bowery.
And you might want to hold my question too, but I just wanted to say that it seems like a lot of the comments we've gotten that were against the mask mandate may not be aware of all that is being done to inform and educate the public in terms of the importance of wearing a mask and social distancing, and to, you know, give perhaps warn people before a fine is levied or something more serious is put in place. Is there something we can do to get the word out that that's not the first step, that the health department has emphasized, you know, getting information out and educating prior to any sort of sanction against someone who's not following the rule?
Supervisor Murray, I ask also that that be reserved for the discussion.
Okay.
And it comes up. Thank you for this.
Can I have one more question? Will the Veterans Administration also be administering vaccines in the state of Wisconsin?
That's for Director Giese.
Yes.
So thank you for that question, Supervisor Maury. I am not certain of I'm not certain of the the Veterans Administration status as a vaccine provider. That group is certainly a priority to vaccinate. And again, as a vaccine provider, there's a permission process, and I'm assuming at a federal level they are working through those systems to make sure that those federal providers are also able to provide vaccine.
Okay, thank you.
Supervisor Pagonis.
Thank you, Chair Smeyer. I have a quick question. Director Giese, what is the storage situation like? I know that some of the freezers have been, the very cold freezers have been cleared out to help out. I know the chemistry department, they cleared out their freezer in case you needed it. I'm wondering how you're storing it and you know, what's going on with that.
Thank you for that question, Supervisor Pagonis. The very cold storage that I think many people are familiar with is for one of the two types of vaccine, that is the Pfizer vaccine. The state did come up with a very specific process for storing those vaccines in what they are calling hub locations across the state. And from those hub locations, only sending them out to the vaccinators when they're ready to vaccinate. So currently, the state is managing that process for the Pfizer vaccine. And there are hub locations across the state with individuals, including the National Guard, that are ferrying the actual vaccine to the locations that are providing that vaccine type. The Moderna vaccine does not need that extreme cold storage in the same way. And so right now, the ability to store vaccine has been handled well in Wisconsin. Certainly, as the number of dosages increase, we hope the number of dosages coming into Wisconsin increases. Certainly, the state will be working through all of those various storage sites to make sure we keep vaccines safe.
Thank you.
Thank you. Supervisor Maury, would you please lower your hand, or if you wish to speak again? Thank you. Next item on our agenda is update in the Branch 6 courtroom from Administrator Shaw.
Thank you, Chair Smeyer. As the board will recall, 2019 Act 184 was the judgeship bill, which was published on March 6, 2020, and that provided that the Director of State Courts could add a total of 12 circuit court branches over a 3-year period. After that point, Eau Claire was identified as being one of the 4 counties that would have been considered with a new circuit branch effective August 1st, 2022. We have, over the last number of years, set aside funds to actually build out that 6th courtroom in Eau Claire County. Recently, we reviewed the timeline with the state and with our local partners, and it is deemed to be prudent to look at a build-out date of around November 1st, because at that point we will be including on or preparing the work to have ballots go out for an election that will have that judgeship in place by August 1st, 2022. And so our facilities director will be taking the original plans from that, dusting those off, and issuing a request for proposal at this time so that we can add a longer duration of potential build-out times so that we are able to obtain the best rate for that build-out. And so the presentation this evening is simply to give the board an update on that timeline and the reason for putting some flexibility into the bid process. Thank you.
Are there any questions? I see no hands raised and I hear no voices. Thank you, Administrator Shaw. Next item on our agenda is written reports. You have these in your packet. The 2020 Contingency Fund Update, the 2021 Contingency Fund Update, the November vouchers over $10,000, and the December vouchers over $10,000. Are there any questions regarding the written reports? I hear none. Thank you. In this, the next section is presentation of petitions, claims, and communications. We have 4 rezoning requests. The first from owner Trudy Bello and Todd Hewsome and applicant John E. Manydeeds for the town of Brunswick. The second, a rezoning request from owner Randy Volbrecht and the applicant Eric Knauf for the town of Lincoln. Rezoning request from owner and applicant Gary and Laurel Whaling Trust for the town of Seymour. And rezoning request from owner Laverne Stewart and applicant Craig Wurtzer for the town of Washington. Those will be referred on to a future meeting. We have also an additional item which you received under separate cover. It is a proclamation. This has been reviewed by the Committee on Administration and is now forwarded to the board for your consideration and approval. And I'll ask our new clerk to read the proclamation.
All right. Proclamation proclaiming February 4th, 2021 as Transit Equity Day to bring community awareness to the issues of unequal access of public transit. Whereas Rosa Parks was an iconic figure in the movements for social justice and racial equality and played a major role in the inception of the civil rights movement that ended legal segregation in the United States. And whereas the immediate focus of Rosa Parks' historic protest was the unequal access of African Americans to public transit. And whereas unequal access to public transit based on race, income, and disability have persisted to this day and have to a degree become worse with cuts in public funding for transit and consequent fare increases in many transit systems. And whereas affordable, reliable public transit is an essential public service on par with utilities such as water and electricity and part of a strategy to combat climate change. And whereas the expansion of public transit provides the opportunity to continue the tradition of Rosa Parks and the civil rights movement by ensuring that transit systems are affordable and accessible, and that people of color, economically disadvantaged people, people with disabilities, and other marginalized populations have full access to the benefits of public transit. And whereas the expansion of public transit provides an unprecedented opportunity to create a large number of good, environmentally stable, high-skill, family-supporting transit operation jobs, as well as construction jobs for building new transit facilities. And whereas increased community access to public transit enforces a reduction in racial, economic, and other disparities while building mobile equity within the community. Now, therefore, as chair of the Eau Claire County Board and on behalf of the entire county board and the citizens of Eau Claire County, I do hereby proclaim Thursday, February 4th, 2021 as Transit Equity Day and support the City of Eau Claire Transit System's tradition of placing a red rose upon the front seat of every city bus to remember Rosa Parks on her birthday and draw attention to the continuing racial, economic, and other inequalities in access to adequate public transit in America.
Thank you. The chair looks for a motion to approve.
Motion by Leary.
Motion by Supervisor Leary, second.
Neiman.
Snyder.
Oh, that was a good group. I'll take Supervisor Neiman's second on that. Thank you. Are there any questions or discussion regarding the motion? I hear none and I see none. Supervisors, we'll do this by voice vote. All those in favor of approving the proclamation, please indicate by saying aye.
Aye.
Aye. All those opposed by nay. It is unanimous. Thank you. The next item on our agenda from the Committee of Administration is File 100. Clerk McDonald.
Ordinance to create Chapter 8.35 of the Code, COVID-19 Communicable Disease Mask Requirement.
Thank you. This is first reading of the ordinance. This will come back to our next meeting.
Chair Smyer.
Who is asking?
Supervisor Neiman.
Supervisor Neiman.
I move that we set aside the rules of order in order to act on this ordinance tonight.
Your motion is in order. Is there a second?
Judy Gatlin, I second.
Second by Supervisor Gatlin. A motion to, the motion similar to this is subject to debate. Is there anyone who has a question or a point of discussion?
Supervisor Neiman.
I'm sorry, who's that?
Supervisor Neiman.
Okay. What you're speaking to is the motion that has been made.
Right.
Okay, go ahead.
I think it's important to address this tonight because one of the purposes of this ordinance is to be prepared in case Governor Evers' statewide mandate does not stand. We need to move on this in a timely way in order to fulfill this purpose.
Thank you. I'm looking, I see no one. I'm sorry. Supervisor Chilson.
Thank you, Mr. Chairman. I disagree with this, taking this up tonight. The public has been under the impression this is first reading. There's many people that have opinions about this. And to move this forward tonight when it was under the guise that it would be a first reading only is a travesty to them and all the people who may or may not be in favor of this. So I am going to vote no on that, and I hope everyone else will, because that's really not the way that we should respond to our constituents. Thank you.
Is there anyone else who wishes to speak to the motion to suspend the rules?
Mr. Chairman, Ray Henning.
Supervisor Henning.
I agree with Supervisor Chilson. I don't know what the rush is on this. It wouldn't take over until the end of June, and this is January. I don't know. I just can't read into this what the rush is. There's got to be something that I don't know and haven't been able to find out. And I don't think that that and also the $200 fine are either one fair. I've been down by Lisa's office, and I've watched people walk with no masks on. I didn't see anybody going out and enforcing a $200 fine. I think it's a joke to have a $200 fine to start with. Thank you. I'm going to vote no.
Okay. Supervisor Russell.
I guess this is a point of order, Chair. I thought suspending the rules was not debatable.
You are correct. Thank you for observing that. I wasn't going to confess to that mistake.
Okay. Yeah, it's just, and can't be amended and 2/3 required.
That's correct. However, I'm going to take privilege as a chair to accept comment on the motion. Is there anyone else who wishes to make comment? Apparently not. I'm going to ask the clerk to take a roll call vote on this. It requires a 2/3 majority. We have 28 members, I think. Is that correct, McDonald? We have 28.
Yes, that's correct.
Okay. That would mean we would have to have, trying to do the math, 19? 19 votes. Clerk McDonald, please take a roll call vote.
Chairman Smyer, can you explain the yes and no votes?
Okay, thank you. Yes vote would mean that we would be suspending the rules. A no vote means we do not suspend the rules, and this item goes to second reading. Okay, Supervisor. Yes.
Am I taking the vote now, or was someone else speaking?
I don't think there's anyone else speaking. So go ahead with the roll call vote.
Okay. Supervisor Gibson?
No.
McKinney?
No.
Knight? Supervisor Knight? We'll move on and we'll see. Supervisor Pagonis?
Yes.
Supervisor Anton?
No.
Supervisor Zook?
No.
Supervisor Chilson?
No.
Supervisor Stelgis?
No.
Supervisor Maury?
No.
Supervisor Coffey?
No.
Supervisor Henning?
No.
Supervisor Bates?
No.
Supervisor Russell?
No.
Supervisor Gatlin?
Yes.
Supervisor Smyer?
No.
Chair Smyer?
No.
Supervisor Hambuck Boyle?
No.
Supervisor Neiman?
Yes.
Supervisor Neiman?
She said yes.
Okay. Supervisor Dunning?
No.
Supervisor Wilkie?
No.
Supervisor Anderson?
No.
Supervisor Beckfield? Oh, he's not here tonight. Supervisor Schneider?
No.
Supervisor Schneider?
No.
Supervisor Leary?
No.
Supervisor DeLuca?
No.
Supervisor Jansen?
No.
Supervisor Schroffnagel?
No.
Supervisor Roberts?
No.
Supervisor Kronk?
Sorry about that. No.
And Supervisor Christofferson?
No.
Can we go back to Supervisor Knight? Did not hear a response on that. So I have,
Here he is.
oh, he's there. Okay. Supervisor Knight, yes or no?
Yes.
Yes, okay. All right. So I have 4 yeses.
The motion does not pass. The item will go on to second reading at the county board meeting. The next item on our agenda, on item 10, reports of standing committees, commissions, and boards, and second reading of ordinances from the Committee on Human Resources, File 107.
Resolution to continue emergency paid sick leave after expiration of the Families First Coronavirus Response Act.
Motion.
Gatlin motion.
Moved by Supervisor Gatlin.
Dunning, second.
Second by Supervisor Dunning. Since Supervisor Beckfield isn't here, I'm not aware of who provides background information on this.
This is Supervisor Gatlin, Vice Chair. I can provide.
Oh, thank you very much. Go ahead.
You're welcome. This is pretty self-explanatory, but at the end of 2020, the federal government's emergency paid sick leave has expired, and as an employer, the county is opting to keep it available to our employees for the first quarter through the end of March. The emergency paid sick hours of paid leave if an employee had reasons to be off of work because of things to do with the COVID. As the fact sheet shows, it's if they had to be, they couldn't telework or be at work, they had to quarantine, or if they had had to be off because of a family member or a child whose childcare or school is closed. So employees are encouraged to continue using their PTO if it's available. If they use part of their PTO, they can use the rest of it to exhaust the 80 hours by the end of the quarter. So this is a good thing for our employees at this point in time. And if we need it, we'll probably look at it again after the end of the first quarter. Thank you.
Questions or discussion?
It was passed unanimously by the committee.
Thank you. Questions or discussion? I hear none at this point. I see no hands raised. So, supervisors, I assume you're prepared to vote. We will do this by voice vote. All those in favor of File 107 indicate by saying aye.
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 Those opposed by nay. It passes unanimously. Thank you. Next is from the Committee on Parks and Forests, File 91.
Ordinance to amend section 16.30.010D.26 of the code. Designation of park, special use area, and wayside boundaries and lands subject to this chapter. To create 16.30.010D.27 of the code. Designation of park, special use area, and wayside boundaries and lands subject to this chapter.
Thank you. Supervisors, this is before us for second reading. So I look for a motion.
So moved, Schaffnagel.
Moved by Supervisor Schaffnagel.
Second, Hamburg-Boyle.
Second by Supervisor Hamburg-Boyle. Supervisor Stelches. Go back up.
Yes, thank you, Chair Smeyer. As you heard this evening from one of the persons who called in from public comment, this particular area has for quite some time been subject to a lot of unsafe and nuisance firearm use. And so this code change is to try to at least disperse some of that activity. You did also in public comment receive a written comment of another person in support of that, and also at the committee level we received several comments in support of that. Just a little background here. Within public lands, and particularly within county forest lands, we have several different levels of designations, each with their own set of regulations. We have parks, which are the most restrictive, and I think we're all familiar with parks like Lowe's Creek and Lake Eau Claire and so on. We have 7 parks. We also have 13 special use areas that have their own separate designations. Those areas typically would be like the area surrounding Big Falls that's not immediately within the park, and the Lions Club Park that is along the Eau Claire River on Highway Q, and Gettinger Woods is a special use area, and that has its own regulations as well. We also have 26 designated waysides, which are parcels that have, again, their own separate regulations. But the most salient of those is that you can't be shooting within a wayside. Some of the wayside areas that we have would be the Lake Eau Claire North Beach area, Hamilton Falls Canoe Landing, and the Lake Altoona Canoe Landing along the High Lines off of Highway Q. That's typical of a wayside. So what we're doing here is we're just designating a very small parking area next to a large block of county land that is very close to town, probably one of the closest areas of county forest to the city of Eau Claire. Then it gets a lot of uncontrolled shooting pressure. So we're creating about a 1.5 acre area where people park and say you just can't jump out of your car and start shooting, which is essentially what's happening here. So that's the essence of this, and I would ask for your support.
Thank you.
This would become wayside number 27.
Thank you. Are there any questions? Is there any discussion?
This is Joe Knight. I have a comment.
Supervisor Knight.
One thing that sold me on the need for this was a letter the committee received from a fellow who identified himself as an NRA member and a member of the Eau Claire Rod and Gun Club and a member of the Augusta Rod and Gun Club. And he said, hey, there's a lot of unsafe shooting going on out there. So this was hardly a guy who was anti-gun, but the fact that this guy had safety concerns, I guess, pretty much sold me that there was an issue here.
Thank you. Is there any other discussion? Any other questions? I see no hands raised and I hear no voices. Supervisors, we are prepared to vote on file 91. All those in favor of file 91, please indicate by saying aye.
Aye.
All those opposed by nay. Is unanimous. Thank you. Next, from the Aging and Disability Resource Board, file 94.
Resolution supporting increased funding for aging and disability resource centers.
Motion?
Motion by Supervisor Cronk.
Moved by Supervisor Cronk.
Second by Shrapnagel.
Second by Supervisor Shrapnagel. Okay. Sorry. I'm not aware of who's going to provide background on this.
Chair Smyer, this is Supervisor Cronk, and I can provide background.
Thank you very much. Go ahead.
Thank you. As you know, as with many of the funding sources, the Aging and Disability Resource Centers across the state have been continually asked to do more with less. And as you'll note in the fact sheet, and if you've looked at the resolution, we know that there's differences in funding that occurred when the different ADRCs were established. So the first generations of ADRCs received more money than Generation 2, which received more money than Generation 3s. Eau Claire is a Generation 2, but this has affected and created inequities in how funding is distributed across the state. And because the funding calculations or the funding formula for ADRCs has not changed or increased since the year 2006, you can imagine as populations age and the need for increased services and paying attention to providing services in an equitable way, that there is always need for more funding. So this resolution is supporting an increase in funding by the state of Wisconsin by providing an additional $27.4 million funding for the 2021-23 state biennial budget. And just as a few extra points, we're looking at the funding analysis. The new allocation would be based on some of the following factors within each county or ADRC, which would create more fair and equitable funding. They would include the population sector weight with ages 60 plus in their populations, 30% for ages 18 plus population with disabilities, ages 18 plus population of minorities, as well as populations that are experiencing poverty, and ages 75 plus within their populations. And the following areas were identified for expansion within ADRCs, including the dementia care specialists, the elder benefit specialists, caregiver supports, health promotion, care transition, resource center services for tribes, and additional support systems. And again, really considering, age, scope of disabilities, looking at health inequities, because that is not considered within the funding. And as we're looking at many of the services throughout the county, we're asking ourselves, how are we responsible for ensuring that we're providing equitable resources? So we've been told, apparently by DHS, that if this were to pass, that the Eau Claire County's ADRC grant allocation per the draft would potentially increase by almost $485,000 per year. So I hope that we see these as great resources. I'm always proud of the work of the ADRC of Eau Claire County as someone who talks to ADRCs throughout the state, and to be able to provide more services and more funding. Hopefully this will pass and get your support unanimously. So thank you if anybody has any questions.
Thank you. Questions or discussion?
Schneider with a question.
Supervisor Russell, followed by Supervisor Schneider.
Thank you, Mr. Chair. This is just a minor thing, maybe just an editorial change, since on the last paragraph, DHS Secretary Designee Andrea Palm is not going to be in that position beginning tomorrow. We might want to update the name on that.
We'll take that as an editorial correction, because I don't think there's a name there yet that's been confirmed. So,
well, she wasn't confirmed either, but Karen Timberlake will be the interim.
And the new one may not be either, but we'll see. We'll take that as an editorial correction. Any other? Oh, I'm sorry, Supervisor Schneider.
Is this something that will go to the Wisconsin Counties Association as something that maybe they would also be interested in getting behind?
Supervisor Cron? Supervisor Cron?
Sorry, I muted myself. Yes, that's a great ask. And if you notice in the very end at the "be it further resolved," this will be sent to also the Wisconsin Counties Association.
Missed it.
Thank you.
That's okay.
Is there any other discussion?
I have a question as well, Mr.
Supervisor Bates.
The one thing that I don't know whether you've looked at the Wisconsin Counties Association platform, but there's a significant number of resolutions. This is much more specific than what's in there, but I certainly would suggest you cross-check it to the resolutions that are already on file.
That would be a comment directed to Supervisor Cronk, I believe.
Yes, please.
Okay. Supervisor Cronk, did you have any response to that?
No, I did not. That's helpful information, but I have not cross-checked that.
Okay. I see no hands raised. I hear no other voices. Supervisors, we proceed to a vote on file 94. All those in favor of file 94, please indicate by saying aye.
Aye. Aye.
All those opposed by nay. It is unanimous. Motion passes. Thank you. Next item on our agenda is appointments. These are appointments that I, as the chair, have already made. These have been processed through the Committee on Administration, which confirmed these appointments. and the chair now asks the board to confirm the appointments. I'm going to take them by committee or board. First is the Highway Building Committee. The names that you see listed there follow the original resolution creating the committee. So we are, I have appointed, and you are, I hope, confirming the appointment of Chairperson Smyer, Vice Chairperson Bates, Second Vice Chair Wilkie, Supervisor Ray Henning, Supervisor Robin Leary, Supervisor Jim Dunning, Supervisor Judy Gatlin to the Highway Building Committee. May I have a motion to confirm, please?
So
This
moved,
is
Humbug Boyle.
Humbug Boyle moves.
I would
Anderson,
second that. Oh, go ahead.
Anderson, second.
Okay, Supervisor Anderson seconds. Thank you. And I will assume there are no questions. All those in favor of the appointments as listed, please indicate. I'm sorry. All those who wish to confirm the appointments as listed, please say aye.
Aye. Aye.
All those opposed by nay. Thanks. The next appointment is to the Human Services Board. I have appointed Jim Catlin. It has been confirmed by the Committee Administration, and I now look for a vote of confirmation from the board. Motion?
So moved.
Moved by Supervisor Bates,
Second, McKinney.
second by Supervisor McKinney. All those in favor of the appointment of Jim Catlin, I'm sorry, all those confirming the appointment of Jim Catlin, please indicate by saying aye.
Aye.
All those opposed by nay. Thank you. Broadband Committee. I've appointed Tom Lange. It's been confirmed by the Committee on Administration, and the chair now looks for a motion to confirm from the board.
So moved, Supervisor Mowry.
Supervisor Mowry moves.
Dunning seconds.
Supervisor Dunning seconds. All those in favor of the appointment of Jim Catlin to the Human Services Board, confirming
You're on the next one.
Yeah.
I'm Lang.
Please indicate by saying aye.
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 Opposed by nay. It's unanimous. Thank you. Finally, the Broadband Committee. I've appointed Tom Lange. He has been confirmed by the Committee on Administration. The chair now looks for a motion to confirm the appointment of Tom Lange.
That's the one we thought you were doing.
We just did.
We just did it.
Boy, am I
Somehow you
listening
picked up
today.
I think we did Human Services twice, maybe.
We like him.
You got it done, Mr. Chairman.
And we confirmed everyone.
Yes.
We have
Thank you.
confirmed. We're okay.
Thank you. I'm going to get my head against a brick wall after this. We have reached the end of our agenda, but I have two announcements or comments to make. The first is actually for the general public. We accepted public comment on the ordinance tonight. It is not necessary to submit your comment again. However, you have the privilege of submitting it if you wish when this item comes back to the county board next time. We're trying to cut down on a little of the process. And finally, once again, I want to welcome and thank Sue McDonald, our new county clerk. Supervisors, we have reached the end of our agenda. We are now adjourned.
Chairman Schmeier?
Oh, sorry, wait, what?
This is Chairman Zook or Supervisor Zook.
Yes, sir.
I have a question. Earlier this evening, we voted on what was basically, the motion was to suspend the rules in the mask update or mandate, and it was voted down. At what point did we vote on the first reading of that mandate?
We don't vote on first reading. What we were voting on is whether or not we should take it up or vote, take up the mandate in this meeting. That was the motion to suspend the rules. When that motion is defeated, we're back to first reading, and then it now goes to second reading.
Right. But have we had a first reading then?
Yes. Yes, that was the first reading.
When?
When it comes before the board for first reading, that means you have the item in your packet for your consideration. So when I say this is first reading, that means the assumption is now you have it before you, and you assume that you will be thinking about it and be prepared at the next meeting to vote on it.
Okay,
We don't actually read it, if that's what you're asking.
okay, thank you.
Okay. Supervisors, we are now adjourned. Thank you.
Good night.
Good night. Thanks, everyone.
This program was brought to you by a cooperation between Newsworks and Eau Claire County.